One of the most talked about topics for infants and babies' health is tongue ties. And now more than ever, it's getting the blame for countless pediatric health conditions. So many questions surround this topic, and we want to talk about this. In this video, we're going to break down the science behind your baby's tongue tie, and not just the potential difficulties that they can cause with breastfeeding, speech, and neurodevelopment. We'll go way deeper than most do and investigate why we're seeing so many of them in practice today and what the true root cause of all of this trouble may actually be. My name is Dr. Eric, and I am one of the pediatric chiropractors here at Adio Chiropractic in the Madison and Middleton area. We focus on pediatrics, prenatal, and family wellness here in this office. Now, this video is for parents, moms especially, who are wondering, one, if their baby has a tongue tie. It seems like every practitioner has a different opinion on its severity. And then two, is this the reason that they are struggling with latching, with uncomfortable nursing, gaining weight, colic, reflux, and overall comfort? We're going to talk about the potential causes of tongue ties, and we'll look into the connection between the prenatal development, the birth process, and the prevalence of tongue ties, and most importantly, give you the best care options that address the cause of the tongue tie. Now, before I go any further, please share this video with other moms, other parents who you know need to hear this information. This is not something that is going away, but we need to address this because so many little kids are going through this struggle. So let's get into the science now. First, I want to talk about what is a tongue tie and the symptoms that commonly follow with a tongue tie. Now, a tongue tie is a condition that affects newborns where there's a strip of tissue that anchors the tongue to the floor of the mouth and is too short, restricting that actual movement and function of the tongue. Now, this can make it difficult for a baby to, one, breastfeed effectively, as they may be unable to properly latch and nurse effectively. Now, you may also commonly see this condition referred to as what we call TOTS, which is tethered oral tissue, which include discussion of the frenulum and other connective tissues of the mouth and the jaw structure. Now, some babies with a tongue tie have difficulty really opening their mouth wide enough to really effectively latch and breastfeed, leading to difficulties such as have difficulty with attaching to the breast or staying attached for a full feed, being unsettled and seem to be hungry all the time, not gain weight as quickly as they should, or make this like clicking sound during the feeding. And many of the signs and symptoms of a tongue tie mirror those of general colic and neurogastric distress in a child. So it's often difficult to really distinguish between the two, and most importantly, what the root cause is of your child's nursing and sleep challenges. Now, is it a tongue tie that's really causing my baby to struggle, or is it something else? And really, to answer this question fully, we have to dig into what is causing a baby's tongue ties. You know, the traditional medical explanations often attribute tongue ties to genetics, but there's more to the story really with that. Some natural health practitioners connect it to mutations in what we call the MTHFR gene, affecting the folate absorption, and studies that suggest that increased folic acid intake, like in prenatal vitamins, may actually play a role. But as a pediatric chiropractor, we specialize in the neurology and the neurodevelopment. We go beyond traditional approaches, exploring factors like soft tissues and nutrients and here's the key. The tone of the nervous system influences the tone of the muscles and soft tissue. If the mom and the baby's nervous system is stuck in a fight and flight mode, it can affect the frenulum and it can affect the mouth and the jaw. Now, while the physiology and the chemistry matter true health and development start with the nervous system. The nervous system is key in perceiving our environment and coordinating cell behavior. So applying this to the tongue ties, it becomes clear how various issues can arise. Ultimately, tongue ties, like many conditions, are often a combination of factors, this perfect storm that we often talk about. Now, what is the connection between stress and prenatally and at birth with TOTS? This perfect storm so often comes prenatally from an emotional fight or flight response of mom and baby. And this is actually compounded by the birth process or delivery. When babies have this physically stressful birth, it really commonly includes two components. One, a misalignment, and two, a fixation of the spine that are biomechanical and musculoskeletal in nature. Now, combine this with in utero stress, and a neurological component arises during key developmental periods. In fact, there is a study that actually observed healthy newborns, and they found that a whooping 99 out of 100 healthy newborns did have an incidence of what they call, because they were osteopaths, somatic dysfunction, aka misalignment and fixation or stress during the birth process, causing an already stuck cranial and oral system that developed in utero to be further twisted and torqued, putting even more pressure on the baby's delicate neuro-oral movements. Now, some care options for tongue ties. Most parents choose to have their child undergo a tongue tie revision surgery performed really by a pediatric holistic dentist. Now, this procedure is crucial for both short-term and long-term well-being, considering its effects on the nutrition, on the neurological development, and on the emotional bonding with the parents. However, just like many medical procedures, there are factors to consider when making this decision. If babies experience stress in utero or abnormal fetal positioning and birth trauma, this could lead to increased tension and thickness of the soft tissues to be a protective response to the entire neurological system. And here's the catch. If the tongue tie is surgically revised without considering the underlying tension and without consulting a pediatric chiropractor first, then things may initially worsen instead of improving after the surgery. Now, in this scenario, the original cause and musculoskeletal tone that contributed to the problems remained undressed. And additionally, the child has to cope with the pain and the restrictions that often accompany the post-surgery recovery. It's a lot to handle for our little ones that we see so many times struggle with this. So the key takeaway is this: before considering surgical revision, measure the stress and tension in the baby's nervous system and help to remove and unwind that nervous system along with the connective tissue revision. By doing this, we can work together with the surgical revision, which can lead to the best short-term and long-term outcomes for your child. Now, we know navigating tongue ties or potential tongue ties can be complicated and complex, and we are here to help. Again and again, we find that a baby's tongue tie comes with moderate to severe tension and stress in the nervous system. You can see an example that I have right here of that neurological interference and stress that's on this insight scan, which was of a recent infant patient who had already had a tongue tie revision surgery. Now, we focus on the scan as it shows us exactly where the baby is struggling neurologically. With it being a thermography and looking at temperature changes, it is very gentle and non-invasive and can be done actually while baby is being held by either mom or dad. Now, for more resources and information, check out our blog page and read the article about tongue ties that talks more about tongue ties, their causes, the symptoms, and really the solutions, because we are here to help. So first and then to end, just please ask any questions or leave a comment down below or send us a direct message. Second, please, if you found this to be helpful or you know someone, please share this with other parents, family, Facebook groups who you know need this information. Third, again, click on the blog link in our bio if you're on Instagram and read the blog about tongue ties. Or if you're ready to just take that leap and really, get down to that root cause and figure out, is this what's going on with my little one? Then give our office a call at 608-824-0950 or send us a direct message. We would love to be able to see if this is what your little one needs to really start to change this trajectory that they are on.